The landscape of weight loss just changed forever as on December 22nd, 2025, the FDA officially approved the Wegovy pill. Since then, my inbox has been flooded with one question: Doctor, should I switch from the injection to the pill? Up until now, we've relied on weekly injection to get those double-digit weight loss results. But now that we have a once daily tablet, many of you are wondering if it's just as strong, if it's cheaper, and if it's finally time to say goodbye to injections. Hi, I'm Dr. Bazgha Khalid, and today let's discuss Wegovy injection versus pill to help you decide which one is better for your metabolic health and weight loss needs. So, what is Wegovy injection and pill? Both the Wegovy injection and the Wegovy pill use the same exact active ingredient, semaglutide. And how do they work? Semaglutide mimics a natural hormone in your gut called GLP-1 or glucagon like peptide 1. It tells your brain you're full, slows down your stomach so you stay full longer, and helps your body handle insulin better. The difference is that for the injection, you take it once a week because it's injected into the fat, it bypasses the stomach and goes straight into your bloodstream. For the pill, you take it once a day. Because your stomach acid tries to destroy it, the pill has a much higher dose of 25 milligram to make sure enough of it actually gets into your bloodstream. Let's talk about the dose gap difference between the injection and the pill. You might be looking at the numbers and thinking, wait a minute, 25 milligram in a pill versus 2.4 milligram in a shot? That's over 10 times the amount. Is the pill dangerous? It's a great question, and the answer lies in something we call bioavailability. The injection is like a direct flight. When you use the Wegovy injection, you're putting the medicine directly into your fatty tissue, where it is absorbed nearly 100% into your bloodstream. It's a direct flight to where it needs to go. That's why we only need a tiny 2.4 milligram dose to get the job done. Now for the pill, it's more like an obstacle course. Your stomach is designed to destroy things. It's full of acid and enzymes meant to break down protein. Since Wegovy or semaglutide is a peptide, basically a small protein, your stomach sees it as food and tries to digest it. Even with a special bodyguard ingredient in the pill called snack that helps get through, only about 1% of that pill actually survives the journey through your stomach into your bloodstream. Let's take a look. The reason the pill is 25 milligram while the shot is only 2.4 milligram in their highest maintenance doses comes down to the stomach tax. Because your stomach is an acid pit designed to digest protein, it destroys about 99% of the pill before it can ever reach your bloodstream. We have to give you a massive 25 milligram pill dose just so that tiny 1% that survives can sneak through and do its job. The injection, on the other hand, is like a direct flight that bypasses the stomach entirely, which is why it only needs a tiny dose to get the exact same results. This is the math. We give you 25 milligram in the pill, but your body only absorbs about 0.25 milligram to 0.4 milligram of it. Because you take the pill every day, the small amount builds up until it matches the level of weekly 2.4 milligram Wegovy shot. So the 25 milligram pill isn't stronger. It just accounted for the toll tax your stomach charges to let the medication through. This is also why that 30-minute fasting rule is so important. If you have food or coffee in your stomach, that 1% absorption of the pill drops to zero, and the pill won't work at all. So how about clinical results? Which one makes you lose more weight? If you want to know the numbers for weight loss, let's look at the Oasis 4 trial for Wegovy pill versus the Step 1 trial for Wegovy injection. For the Wegovy injection, on highest dose of 2.4 milligram, participants lost an average of 14.9 to 15% of their body weight over 68 weeks. For the Wegovy pill of 25 milligram, participants lost an average of 16.6% of the body weight over 64 weeks if they followed the rules perfectly. So, which is better? Clinically, for weight loss, they are a tie. The results are remarkably similar. However, the pill is more sensitive to how you take it. If you don't take the pill correctly, that 16% weight loss can drop significantly. On the other hand, the injection is much more forgiving because it's once a week and you don't have to worry too much about when and what you eat for breakfast. So, how do you decide between the two comes down to your daily routine and your personal preference. This is where the choice usually gets made. The pill golden rule is you must take it first thing in the morning on an empty stomach with exactly 4 ounces of plain water. Then you have to wait 30 minutes before you drink coffee, eat, or take any other pills. If you are a coffee first person, the pill might be a struggle for you. The injection golden rule is you take it once a week, any time of the day, with or without food. You just have to remember the same day every week. I want to know, are you a set it and forget it weekly shot person, or do you prefer a daily pill routine? Let me know in the comments. Now let's talk about myths versus facts and who is a candidate. Myth is the pill has fewer side effects, while the fact is both injection and pill can cause nausea, diarrhea, and constipation. However, the injection can cause skin irritation at the site, while the pill can sometimes be tougher on people with sensitive stomach or acid reflux. Who is a better candidate for the Wegovy pill? If you have a needle phobia, if you travel frequently and don't want to carry refrigerated pens, or if you are already in the habit of taking daily oral medications. And who is a better candidate for the Wegovy injection? If you have a busy morning and can't wait 30 minutes for coffee, if you have gastroparesis or very slow digestion, or if you prefer the simplicity of once a week dosing, then injection may be a good option for you. How about cost? In 2026, the cost of weight loss medications is finally coming down some. Wegovy pill starting at $149 per month for self-pay through the manufacturer pharmacy for starting dose of 1.5 milligram pill. Price is higher between $199 to $299 for higher doses of Wegovy pill, which is what most people will need for any meaningful weight loss. And if your insurance covers Wegovy pill, then your copay may be as low as $25. For Wegovy injection, prices through the manufacturer pharmacy are $199 for the first 2 months for starting doses of 0.25 and 0.5 milligram, and then $349 per month for higher doses. So how does Wegovy pill or injection compare to Zepbound? Zepbound injection still holds the weight loss crown at about 21%. But it is only still available as a shot. If you want a pill that rivals the big shots, the Wegovy pill is currently your only FDA-approved oral GLP-1 medication option for weight loss. Let's talk about questions that you may want to ask your doctor. Before you switch from injection to the pill or decide between the two, ask your doctor these 3 things. Will the 30-minute fasting window interfere with any of your current medications? Think of thyroid or blood pressure medications. Based on your stomach history, do you think I'll tolerate a daily pill dose better than a weekly injection? Is the 25 milligram Wegovy pill or 2.4 milligram Wegovy injection covered better under your specific 2026 insurance plans? At the end of the day, the best medication is the one you can actually stick to, whether it's a tiny pill or a quick weekly injection. The goal is the same, a healthier, happier you. If this comparison helped you, please hit that subscribe button. I'm here to help you navigate these new medical breakthroughs so that you can make the best choice for your health. Drop a comment below, pill or shot. Stay happy, healthy, and well. I'll see you in the next one. Bye for now.